And welcome everyone to this ninth PARC Study Speakers Series. Today I'm delighted to introduce a good friend and colleague, Dr. Judah Koller. Judah is an assistant professor of clinical child psychology and special education at the Seymour Fox School of Education at Hebrew University, where he directs the Autism Child and Family Lab. Judah is also director of the Jerusalem region of the Israeli National Center for Autism and Neurodevelopment Research and serves on various local and national committees, including the Israel Ministry of Health's Interministerial Expert Committee on Autism. So this is the formal bio, the formal introduction. I will, of course, add a personal note to this introduction. I met Judah many years ago when he was a postdoctoral fellow at Yale in the US at the Child Study Center. And I was immediately impressed by his knowledge, but also his passion for excellent clinical and research work to support autistic children and youth and their families. And we've since remained good friends and colleagues, and I'm delighted to have the opportunity to introduce him today. Thank you, Judah, for doing this. Judah is going to talk about beyond the child, how parent and family dynamics shape development in autistic children. Welcome, Judah, and the floor is yours.
Thank you so much, Stelios. It is a real treat to be back here, and thank you for your kind words. So I want to express my appreciation to Stelios and to Anna and to the whole PARC team for the invitation to present today. This is actually my second time having the privilege of being part of this speaker series. So 2 years ago, I was here talking about something called family accommodation in autism, which we will come back to in a bit. But today, I want to widen the lens, and I want to share some of the work and some of the thoughts that we've had over the last couple of years, and present a framework for thinking about autistic children in maybe in a slightly different way than we are used to. So before I get going, I want to acknowledge that the work that I'll be presenting, I have the privilege of being the one presenting it, but it's very much not a solo effort. It's a collaborative effort with members of my lab. Here you see on the right at our end of year gathering just a few days ago in my home. And on the left, you see some of the specific, both current and former graduate students who led the work that I'll be talking about today, and also a few key collaborators. So I'll highlight, you see Ilan Dinstein there, and Yonat Rum, and Anat Perry. And so I want to acknowledge that this work is very much a joint effort. And so my custom is sort of to share the credit with everyone, but also to share the criticism where my preference is that, all the positive feedback comes to me, and all the negative feedback, if you have criticism, please be in touch, and I'll be happy to provide you with email addresses of my students and collaborators, so you can, send that directly to them. As Anna mentioned, I will say a word about the words that I'll be using in my talk before I get into the science. So I will be using identity first language. You'll hear me say autistic children rather than children with autism. And I do this because much, although not all, of the autistic community has asked us to use this language. And it shapes, I think, also the way I think about the work that we do and the people that we work with. But I also recognize, as Anna mentioned, that this is not everyone's preference. And so I apologize in advance if anybody finds this offensive, and I do appreciate your understanding. So over the next 45 minutes or so, we're going to try to do a few different things. The first thing that we're going to do is identify a problem that our field is facing, that I believe we are facing because we tend to focus on individuals. I'll be talking about children because my field is largely early childhood, but this challenge is not unique to children at all. We tend to focus as a field on individuals as opposed to what's around the individuals. I'll present a framework that asks us to maybe take a step back and take a broader view on children, on people. I'll provide a few empirical examples from our lab, back to the idea that I spoke about a couple of years ago called family accommodation, a few studies that we've done that sort of put some data into this framework or behind this framework. I do want to mention that I will afterwards talk about work that we've done that has tragically been an opportunity for us to look at the ideas that we think about in really the harshest context possible. And so we've been able to look at some of the ideas that we think about in the context of the war that broke out in Israel on October 7th, 2023, and is still ongoing. And so I'll show some data that we've collected from this most recent time period and from this really terrible context that provides an additional perspective on the same concepts. And then we'll take a step back and think about what this means as clinicians, as educators, as policymakers, as researchers, as people who are invested in the well-being of autistic children and their families. So I was here 2 years ago, and this is the flyer from that talk 2 years ago. For me, the most enjoyable part about coming back was looking at this image and realizing that I haven't aged a day in the last 2 years. So that's a really good feeling. I will say that the work that I presented 2 years ago really focused specifically on one very sort of particular mechanism that, as I mentioned, I'll come back to. And what we're going to do today is zoom out and consider the children or the child in the different contexts in which they grow and in which they develop. I want to start by reminding us of what, for me, is perhaps the most significant challenge in our field, the challenge of heterogeneity, right? There's just a tremendous amount of difference among and between autistic individuals. Autism is massively heterogeneous. And one of the most important forms of heterogeneity actually was given a name by my dear friend Stelios, which he called chronogeneity. In chronogeneity, Stelios coined this term to capture the enormous variability in developmental trajectories among autistic children. So variability in their development over time. We know that some children develop growing independence and adaptive functioning. Others struggle with persistent behavioral challenges. Others regress or follow nonlinear or mixed trajectories. And we see this variability across everything, across cognition, across language, adaptive functioning, and behavior. And despite decades of really careful work and excellent work in our field, our ability to explain why one child follows one trajectory and another a very different trajectory is quite humbling. My argument that I'll try to build over the next 40 minutes or so is that part of the reason for this limited explanatory power is that we've been looking at only part of the picture. We've been looking at the child. When we talk about autism diagnostically, and you think the DSM has its challenges, but we are sort of beholden to it. When we talk about autism diagnostically, we usually talk about criterion A and criterion B, the symptom domains, sort of the behavioral symptom domains. But there are additional criteria in the DSM that are just as important and tend to get overlooked. Stelios and I actually wrote a small piece about this a number of years ago. If you look at criterion D in the DSM, in order to diagnose a child as autistic, we need to not only show that they have impairment in social communication and interaction and the presence of restricted and repetitive behaviors or stereotyped interests. If you skip to D, we must show that there is clinically significant impairment in functioning. Let's think about what that impairment actually is. Impairment is not something within the child. It's not something that lives inside the individual. It's a mismatch between the child and their context. The same characteristic for an individual can be impairing in one setting and not at all impairing in another. And that is the heart of what we call the social model of disability, which locates disability not within the individual, but in the gap between a person with certain characteristics and an environment not suited for individuals with those characteristics. And what's important here is that as soon as we take criterion D seriously, in the context not only of diagnosis, but also in the context of support, then we're no longer focused only on the child. We are treating the child in context, and we are treating the child and the context. Some would argue that impairment has really significant child intrinsic components too, and that is certainly true. I agree with that statement. But the claim that I want to make here is that you can't understand impairment or really work to support a child experiencing that impairment without taking context very, very seriously. And this is a conceptual move that I want to anchor this talk on. Which brings us to the title of the talk. What if focusing on the child for all of these years, for these decades in our field, is not the right unit of analysis? What if in order to really understand and to work to support autistic children, we need to look beyond the child? For most of the history of autism research, the scale has tipped heavily in one direction. We've focused on the individual factors: genetics, neurobiology, cognition, sensory profile, autism expression, and this work has been foundational and transformative and has taught us an infinite amount. But context, family, socioeconomic status, neighborhood, policy, school, these have been largely neglected, treated as background or something to control for, as noise. The argument that I want to make is that contextual factors are not confounds. They are themselves both drivers of and essential parts of development. And this scale that we're looking at must be more balanced than the field has historically treated it. Over the last decade of work in our lab, it's slowly become clear to me that we need to shift our thinking to a framework that is zoomed out in multiple ways. We need to take a contextual view, recognizing that development happens inside nested systems: family, school, broader community. A transactional model recognizes that these systems and the children shape each other. Children shape their environments, and their environments shape them right back in this sort of nonstop back and forth. And a developmental perspective acknowledges that these mutual influences accumulate over time. I sort of think of it like a snowball. Small adjustments along the way, either in the child or in the system, compound, and they push and they pull trajectories in very different directions. And if we want to understand why autistic children follow such different paths, I think that this is the perspective that we need to be taken. Now, to be very clear, I'm not actually saying anything novel or groundbreaking. We're not alone in this argument. This isn't a new argument. Actually, in many ways, not in many ways, in a fundamental way, my thinking has been shaped by the work and the thoughts of others. And I want to bring two recent papers as examples. So one by Marcia Malik and her colleagues, including Stelios and other members of the PARC team. And another paper by Peter Rosenbaum, also a member of the PARC team from CanChild. And I think it's not a coincidence here that you have significant representation of PARC members in these papers. These papers have made similar arguments. So Marcia Malik in her paper argues that contextual factors should be conceptualized as primary exposures, not covariates. They're part of the story, not something next to the story. And Peter, writing more broadly not only about autism, but about childhood developmental disability, argues that children should not and cannot be understood apart from the family and the environmental context in which development unfolds. These two papers together highlight in a really beautiful way for me, in different ways, but in complementary ways, what I see as what I hope is the central sort of conceptual shift taking place in our field. And they also leave us with a question, which is the question that I want to focus on. Okay, context matters, but how does context matter? What are the mechanisms? Because if we can identify specific mechanisms, specific processes by which context shapes development, then we can really start to open up new, novel ways to both understand and support autistic children and their families. Before I show you some of our work in this regard, I want to be careful and very clear that I'm not overclaiming here. This idea, again, is not novel. The field has been talking about family processes and has been looking in different ways beyond the child. There's a lot of work on family processes, on parent-child interaction, on peer environments, on school environments, socioeconomic context, neighborhood effects. All of this exists. There's a rich literature on each of these, and I'm not ignoring that literature or proposing to replace that literature. What I am proposing is that these findings, as they exist right now, tend to live sort of next to or in parallel with each other, rather than in a way that is integrated into a single coherent narrative, a coherent way for us to think about and understand development. We know that context matters. What we do not yet have a good answer for is how these different layers of context interact with each other and with children over time to produce the trajectories that we observe. And that's the gap that the contextual, transactional, developmental, or the CTD model, I'll call it, just to save some time, is trying to point us towards. And it's the gap that we're going to be talking about now. Another paper that comes from the PARC family. So this is a paper that was just accepted very recently for publication to autism research. So I just said that the field knows context matters, but hasn't pulled it together. So I want to give one concrete piece of evidence here. And the question I want to answer is simple. When we say that we have to go beyond the child, is there actually something beyond the child that we can measure, that we can look at? Is there evidence that there is something there to look for? And so this is a paper based on PARC data, recently accepted, like I mentioned, led by Ella Brower, supervised by Beth Kelly and her team. There were 206 families followed for the first year after diagnosis, 6 Canadian sites in addition to ours in Israel. And the takeaway here is that a child's traits in the study do not stay within the child. They register in the family. You see an expression of the child's individual characteristics in the family's functioning. So Ella and Beth's team took the same autism traits and showed that they predict how the family is doing, how the parent is doing, and they don't land in sort of one undifferentiated lump. How often a trait happens, an autistic trait happens, meaning the frequency of that trait, tracks with the whole family's daily life. While how much it disrupts the impact of that trait tracks with the parents specifically. Age and gender don't play a role. This isn't about the child's profile on paper. It's about the fact that the child's traits show up measurably in the family system. And if that's true, if traits register in the family system, then the family is not only a legitimate, but a critical, essential thing for us to study beyond the child. And so the next question is, what is the mechanism, or what are the mechanisms that move a child's traits into the family? And one answer to that takes us back to this idea of family accommodation, which is a way that parents naturally adapt to reduce their child's distress. We think of accommodation as a family level pattern. And a number of years of work at this point show how family accommodation associates with outcomes cross-sectionally. I'll define accommodation to make sure that we're all on the same page. So family accommodation refers to proactive modifications made by a family, usually a parent, intended to reduce the distress of a child, which stems, in this case, from their autism. So we have an autistic child experiencing distress or dysregulation, often connected to a restricted and repetitive behavior or stereotyped interest. And we have parents who, from a good, loving, attentive place, naturally and adaptively change the environment to reduce that distress. In the short term, this is effective. You see the child here on the left. Maybe he has a particular routine every morning with his special yellow car, and he woke up one morning and the car wasn't where it was supposed to be because the mom had been exhausted the night before and just crashed in bed and went to sleep. The child wakes up and he's dysregulated. So the mom has 2 choices. Either she can get ready on time, get his lunch packed, get herself organized for work and head out and get to work on time, or she can say, I'm going to push all that to the side. And the first thing that I'm going to do is going to look in the toy room for this yellow car. It'll delay me 15 minutes. I will get to work late, but my child will be regulated. And that's what she does here. And we see in this image very clearly that in the short term, this is effective. The child calms. But over time, this sort of cyclical pattern becomes part of the developmental system. It shapes what the child practices. And here we see that the mother's behavior is not intentionally teaching the child that he can't regulate himself, that in order to be regulated, he is dependent on her to provide him with this outside object. And so this accommodation shapes what the child practices, what the child learns, and it also shapes what the parent sees, which we'll come to in a few minutes. So I want to show you 3 sort of lines of evidence, 3 studies that we've done in our lab that taken together support this idea that accommodation is not just a response, it's a mechanism. It's built in to the system. So the first comes from the doctoral work of Toby Graucher, a wonderful PhD student. We already had cross-sectional data showing that at the same time point, families who engage in more of this accommodation, and based on what I just said, this shouldn't be surprising, have children with higher levels of negative affect. So they struggle more with their emotional regulation at a single time point. What Toby and I have been doing over the last few years is following the children in our lab to ask whether this is just a snapshot or whether accommodation can actually predict how a child's emotion regulation develops over time. And what you see here is data from a longitudinal sample of autistic children assessed at baseline, which is the time of diagnosis. Here they're between the ages of 18 months and just under 5 years old. And then they're reassessed 6 months later, and again 6 months after that. What we see clearly is that families that engaged in higher accommodation at baseline had children with significantly higher negative affect at every follow-up point. The difference was statistically significant across time. And what this tells us is that accommodation is not just associated with affect in the moment. It's associated, it's part of how the child's emotional life is unfolding. And I want to be careful here. I'm not claiming causation. But this is exactly the pattern that we would expect to see if accommodation was part of the developmental system shaping the child's emotion regulation rather than merely being a reaction to it. Toby then moved from emotional regulation to behavioral regulation. And she asked if accommodation is shaping how children develop emotionally, then the next question should be, how is it shaping their behavioral functioning? And Toby found something that didn't really surprise us at this point. In the same cohort of children, we grouped them by family accommodation levels at baseline, low, moderate, and high. And what you see here is that the difference between these groups, the differences were present at baseline and preserved over the year of follow-up. Obviously, these families are all moving in their levels of accommodation and in their levels of behavioral regulation. But this sort of hierarchy where families who have lower accommodation have children with lower levels of behavioral dysregulation, families with more accommodation have children with greater difficulty regulating their behavior, stays constant, although you do see that there's this funky little dip at the midpoint. Importantly, this is after we controlled for the child's cognitive ability, for their autism expression. And so there's something specific about family accommodation here that is tracking with the trajectory of behavioral and emotional regulation over time. So taking a step back for a moment, looking at the parent and the child in this picture for a second, this is basically the concept that we've been talking about. So if you're less comfortable with data and research, that's okay. I want to sort of make sure that we understand the concept here. On the left, you have this mother who is accommodating. She's arranging the toys exactly the way her son likes, prefers, / needs them to be arranged in order to feel regulated. And she's taking the time out of her schedule to arrange them in just that way. She knows that if she gets it right, she stops his frustration. She prevents him from ever becoming dysregulated before he even starts becoming dysregulated. And it works. You see that he's calm and happy. He's engaged with her in the middle image. And any of us, again, would do the same, right? Because we want our children to feel regulated. We want them to feel good. We want them to be able to be with us. It is a loving, sensible thing to do. What I'm highlighting here, these findings, is what that process of arranging those toys does over time. Accommodation is not just a response to behavior. Again, it's part of the developmental system. When parents organize the world to prevent their child's distress, it works in the moment, but over the long run, that pattern alters what they need to learn and practice. So this boy that we see in this image is not learning tolerance for frustration. He's not learning flexibility. He's not learning independent regulation. And these are the capacities that a child needs to develop. The help that calms him down now, in this moment, is quietly preventing him from moving forward in his development with really essential capacities over time. And this is exactly the kind of mechanism. It's just an example, but this is the kind of mechanism that the Contextual-Transactional-Developmental framework is trying to point at. I want to show you one more study on family accommodation from our lab, which I think is really cool and really striking. I mean, it's a bit of a shift. So far we've been talking about a transactional model, but I've only been talking about how the parent's behavior is shaping the child or influencing the child. But what about the way in which that behavior comes back and shapes the parent? What about the actual transaction? And specifically, how does that shape what the parents see in their own children? So this is a paper that was just published a few months ago, led by an awesome graduate student, Liraz Sasportas Joseph. You see here on the left, together with Michal Perez and Anat Perry, my collaborator. To do this study, we developed an idea, sort of a paradigm that we call Tom Squared, which is also not really novel, but you'll see what we did that I think is novel and uniquely meaningful in this context. So Tom Squared, because we are looking at the parent's theory of mind of the child's theory of mind. It's a direct measure of how accurately parents can predict their autistic child's theory of mind performance. So most measures of parental insight ask parents sort of their general impression about their child, which is fine and important, but it also conflates a lot of things. And what Tom Squared does is something more concrete, more specific. It directly measures how accurately parents can predict their own child's performance on theory of mind tasks. So what does this look like? We have these families coming into our lab, and we set 43 young autistic children down between the ages of 3.5 and 6 years old, with a set of 6 sort of classic theory of mind tasks, starting from the easiest and moving up to the hardest. So for example, the simplest one is about desire. So we have a doll named Guy, And the child comes into the room, and the research assistant says to the child, what do you like more? Do you like cookies or carrots? And almost all the children say cookies, because obviously cookies are better than carrots. And then the research assistant says, well, this is Guy. This doll's name is Guy. And Guy likes carrots. Let's offer Guy a carrot and a cookie. What do you think Guy will choose? And to get this answer right, the child has to set aside what they would want, and they would have to try to reason from what Guy would want. Moving up in complexity, I'm not going to go through all the tasks, just to give you a sense of the types of things that the kids are doing. So we show a child a Band-Aid box, and we ask what's inside, and they, of course, say Band-Aids. And then we open it, and inside is actually a little toy cat. We close the box, and we bring in a doll, and we say, this is Yael. Yael has never seen the inside of the box, and we ask the child, what does Yael think is in the box? Band-Aids or a cat? And to pass this item, the child has to understand that Yael believes something that the child now knows to be false. And we go up in complexity again, but I think enough with the examples. What makes this Tom squared as opposed to just a theory of mind assessment? So after the child does all of these tasks, and there are 6 discrete tasks, and the child does them without the parent in the room, we send the child out to play with the research assistant, and then we bring the parent into the room. And we administer the exact same thing to the parents, but we ask them to answer as if they are their child, to predict task by task how they believe their own child would respond to each item. So we end up with 2 scores. 1, what the child can actually do, and 1, what the parent thinks the child can do. So Tom squared is sort of the degree of match between them. For each test, did the parent correctly predict whether or not their child would pass or fail that item? So here's what we found. First, on average, the parents in our sample were actually fairly good in this, which was a nice to find thing. So they correctly predicted about 2/3 of their child's responses on this task. So parents, at least in our group, generally had a decent sense of what their child can and cannot do, meaning they have a decent sense of what the world looks like through their child's eyes. But, and this is the finding that I want to highlight here, family accommodation was associated with lower accuracy, significantly. So something called the odds ratio was 0.71, which means that for each 1 point increase in our family accommodation score, the odds of an accurate parental prediction of better Tom squared dropped by about 29%. And this was not explained by autism severity or other characteristics, which were only weakly related to prediction accuracy. So the interpretation that I want to offer here, which I think is consistent with everything that we've spoken about until now, is that accommodation is not only limiting the child's opportunities to learn to regulate themselves, to learn to develop capacities and skills, and to learn that they can, on their own, be okay. It's also changing what the parents have the opportunity to see. So when you consistently, as a parent, modify or remove these challenges, you just have fewer chances to observe what your child can actually do without your support. And accommodation doesn't just shape the child. It also shapes what the parent can learn about the child. So if you look at this image here on the left, you have a mom who's sort of sitting on the side while her child is constructing a puzzle. And so she's able to form a fairly accurate representation of what her child's abilities are in this specific task. An equally loving and devoted and caring and attentive mom is also sitting with her child while he's assembling a puzzle, but she's helping. She's scaffolding. She's saying, maybe the blue goes with the blue. She's saying, maybe you want to consider putting this there. Now, this is not bad parenting. This is good parenting. But if she's always doing this, if we always prevent our children from encountering things and dealing with things that are hard for them, then, as I said, we are both at the same time preventing our child from learning skills and developing capacities, and also preventing ourselves from getting a true picture of our child's capabilities. I want to now shift gears. So everything we've discussed so far has been the family system under ordinary conditions. The sort of day-to-day ways that accommodation and parental perception interact with a child's development. What happens when the hardest stress test imaginable comes about? So war is the most total context shock that there is. And when October 7th happened here in Israel, we in a moment had entire families, communities, and societies thrown into a state of shock and trauma and dysregulation. In that moment, I and my entire lab felt helpless, and we wanted to do something. And we created all sorts of materials in Hebrew and in Arabic, English, Russian on our lab website that are unfortunately still there because they are still relevant today. But in speaking to our partners and friends in the community and speaking specifically with a woman named Ronit Schussel, who is then head of research at Alut, which is the largest autism NGO in the country, trying to think with her about what we could do that would be meaningfully helpful to these families and kids, she gave me a mandate. She said, do what you do research. And so we did. And we came to feel a moral responsibility to document what was happening to our kids and our families in that period. So everything I've argued today, that the family is the unit, that context drives the system, is a claim about how families respond to their circumstances. And the circumstances in our country following October 7th opened this really tragic window into understanding this contextual, transactional, developmental framework under the harshest possible conditions. The two images that I've placed on the slide in front of you say it more plainly than I can. And so I won't repeat. But in the studies that we did, which I'll go through now, we asked the following questions. We asked first, how do autistic children and their families respond to this type of trauma? The kind that fills our world and just envelops us? And is there something that we can learn about how we should be helping and supporting these children and families? So the first study I'll show you here is a mixed method study led by Shachar Govrin Aviran, together with Yonat Rum, who you see up there in the corner. It included 72 families, and we did this a few months, 3 to 6 months after October 7th. There are two things that I want to sort of highlight here. First is the load. So we saw very clearly, this was a cross-sectional study. We saw very clearly that autistic children and their parents reported more post-traumatic stress and anxiety and depression than their non-autistic peers, even though both groups were living through the same events. And we also saw this transactional incident happening in families of autistic children, where the parents' own post-traumatic stress was the single strongest predictor of the child's post-traumatic stress, which really makes sense when you stop to think about it. It accounted for 39% of the variance. And the qualitative data that we got from these families helps explain that mechanism. They talked a lot about how routine was the family's sort of regulatory scaffold, what held them together. And when that routine collapsed, the whole system fell apart. So what we saw was that under threat, the child's distress is paired to the parents, and that the family is the unit that absorbs this shock and this dysregulation. The second and third study are really all part of the same cohort. We started tracking a cohort of families of autistic and non-autistic children within 30 days following October 7th. And so what you're looking at here are sort of the baseline findings. Actually, what you're looking at here are pre-baseline. This was just a coincidence, but there were a number of us as collaborators and colleagues who were trying to figure out what to do that would be meaningful. And so we had a meeting on Zoom, and we came on this idea that we wanted to measure the mental health of these children and families. And Ilan Dinstein, who you see there next to Shir and her dog Johnny, who was less involved, I'll say. Johnny was less involved in the study. But Ilan said that he actually had a graduate student who had just finished her master's thesis looking at these issues in families of parents of autistic children a few months prior to October 7th. So we had this sort of pre-October 7th cohort. We didn't follow up that cohort. And so I'm not comparing the same families to the same families, but what you see on in these box plots here is data from families prior to October 7th, where you see they're actually relatively higher, but not very high levels of depression, anxiety, and stress. And then in the cohort that we accessed after October 7th, you see that the levels of these mental health challenges multiplied by 2 to 4 times within 30 days post-October 7th. Having been here, I can tell you that this isn't actually a very surprising finding, but it was still fairly jarring to see this empirically shown. Our question was really what happened next, and that our focus was not, or at least in this talk, our focus is on the interaction between what's happening between parents, families, and children, and that leads us to the developmental arc. So we followed these families up every 2 months over the course of a year, and this work was again led by Toby Gracher along with Tanya Nitzan. And over the year that followed, 2 things happened at once. So actually, parent distress fell really steeply and sort of leveled off. Families of autistic and non-autistic children showed remarkable resilience and recovered in parallel to each other. The fact that families had an autistic child did not lock in sustained risk over the course of the year. So the actual message, the actual takeaway from the paper that's now under review is a message of recovery, adaptation, and resilience. It's not actually a message of group difference between families of autistic children and families of non-autistic children. But what you see here is the actual curve, because that's sort of the point. It's the recovery and it's the developmental and contextual heart of this story. So we followed 62 families, not all of them at every time point, but there were 7 time points across the year. And what you're looking at is parental anxiety, but the plots are very, very similar for anxiety and the other facets of mental health that we looked at, as they are actually for the child's own mental health. And what we see is this very sharp drop from the initial time point. So in the initial time point, almost everyone, not almost actually, every single individual in our study was in the clinical range of every mental health system that we measured, in the severe to extremely severe range. But then you look at the drop, and that I think is sort of the heartening part of the story. By the second time point, the system has already fallen back towards normal, because what you saw here on the ground was NGOs, schools, sometime, and really a grassroots effort to say that there are certain populations out there that are more vulnerable, that are more at risk, more in need of our support and our sort of immediate engagement to help them than others. And there were these remarkable sort of pop-up schools and tents in hotels that families had been displaced to. And there was an attempt to provide any type of framework possible to these families. Now, I obviously don't know what is behind this drop in a real mechanistic way, but I would like to believe that part of it at least stems from that. So you see that the teal line is families of autistic children, the orange is non-autistic. And again, the point to take away is that they move together, actually. The recovery is parallel. Autism diagnosis does not lock these families into risk, although it's important to say that the average here does hide a subset. So there were about 10 to 20% of families in both of the groups that remained at clinical levels 1 year later, which again is not surprising given what was going on. But again, the headline is adaptation. The context moved the system, and the system did recover. And this is the developmental leg of the framework doing its work. The family is not a fixed vulnerability. It's a system that adapts over time. Let's go back for a moment to where we started. So if we go back to the DSM, and if we take criterion D seriously, we understand that impairment is a mismatch between child and context. Then the target of support is the system, is not the child alone. And I want to make 3 sort of concrete points here. First, in working with children and families, we need to assess and consider the family and the context, not only the child. And I'm saying this as someone who teaches in the child psychology graduate program here and in special education. I know that at least in Israel, our systems are not designed for this. Our systems are designed to focus on individuals, but we know that that's wrong. And we know that that is false. And we know that it's potentially harmful because we're missing a lot of the picture and a lot of essential information. So we need to assess and consider the family and the context, not just the child. Everything we just showed, accommodation, Tom squared, the family's regulatory context, these are things that are measurable, that we can measure and that we can move. And so they belong in the assessment rather than in the background. The second is I think there is room to treat accommodation, and accommodation, again, here, it happens to be what I research, but there are, I'm sure, many other examples out there. These mechanisms can be used as developmental levers to impact, to support, and they're not a symptom to suppress or something to sort of push to the side and say, let's focus on the individual. They shape emotion regulation, they shape behavioral regulation, and they shape what parents are even able to see about their child. The third thing that I want to highlight is here is that we have to match the support to where the traits land. So frequency, we said, strains whole family life. Impact strains the parent. A family that is drowning in routine disruption needs something different than a parent whose sense of competence is eroding because they don't feel like they're able to do what they need to do to take care of their child, to take care of the family. The idea of interventions or supports for autistic children or for families it's an umbrella. There is no such thing as a support that will be relevant for all autistic individuals or all families of autistic individuals. That is, it's a fiction, and it's actually dangerous because then we end up applying things that we think will work without making sure that they are appropriate for this specific child, this specific family, this specific context. The goal in the end is the fit between the child and the context. So when we're thinking about support, we also need to be thinking about the child, but we also need to think about modifying the context, modifying the things around the child. And that, I think, is the real sort of takeaway here. So to bring this all together, development is not something that happens just within the child. It takes place within a system of relationships that are transactional, that change over time. And these are things that are essential for us to consider, both in our attempt to even understand why children look the way they do, why they present the way they do, and essentially in the way in which we work to support these children and their families. I want to again express my appreciation to Stelios and to Anna and to you all for being here with me today. And I'm very happy to take all questions.
Judah, thank you. That was fascinating. One of our questions from the Q&A session is asking some details about the accommodation studies you talked about maybe 20 minutes ago now. Are you able to describe how negative affect and disruptive behaviors were measured in those accommodation studies?
Yeah, that's a really excellent question. So those two traits were measured by parent report measures. So we do have a lab-based measure of emotion regulation or temperament as well, but that was not integrated into the findings that I presented here. So it's a really important piece of context that the variables that I presented here, most of them, Tom squared obviously was an experimental paradigm, but those measures were looked at through parent report.
We've got another question from our Q&A. Is there a correlation between families with one autistic child being generally higher on accommodation versus families with multiple autistic children being lower? This particular person mentions that they have multiple autistic children with different regulatory needs. So as a family, they can't simultaneously accommodate everybody. So it becomes sort of a functional issue of needing to swap accommodations depending on priorities.
So the answer is that I don't know. Based on our research, I don't have any data on that. It's a really interesting question. There is no question, and my colleague Yonat, actually, who I mentioned here, does some really important work on siblings and families with multiple autistic children. That isn't something that we have looked at, but there is no doubt that it changes sort of the landscape, right?
Mm-hmm.
It's also, I think I made this clear, but I want to take this opportunity to make sure that I'm making this clear. Accommodation is not inherently bad. It's also not inherently good, right? It really depends on the context. So there are accommodations that parents make that prevent their children from developing certain capacities and prevent, as we talked about, parents from understanding their children's abilities. But there are absolutely accommodations that parents make in certain contexts that are adaptive and that are helpful and encouraging of growth and development. We have data to show that. And we have another study going on right now to sort of help us understand how we can identify those specific accommodations that might be worthy of intervention or change in parent behavior and which shouldn't be. But I do want to be super clear that I'm not making any sort of blanket statements. There are no clear clinical recommendations based on this yet.
Okay. A broad one here. What are some things that make a difference early on for families?
Yeah, so that's really broad, which is lovely actually, because it means that I can take it to wherever
Yes, exactly.
wherever I want to take it. I think I'm not a parent of an autistic child, and so it's important for me to sort of be transparent about that. And so I'm not coming from a place of lived experience. But I think in parenting in general, the most important thing for us is to see our child for who they are, right? And to find our own subjective individual way of connecting with them, of loving them, of conveying that love to them. And I think all of the other things that I could potentially talk about stem from that sort of the most fundamental, I think, need, which is for us to really see our child for who they are, and be there for them in whatever way they need us to be there.
This is also broad, but in a different way. What are the most important things families can do to support their child, and how can governments or nonprofits or NGOs support? So I'm reading that as a bit of a compare and contrast, perhaps, is my interpretation of the question, though I'm not sure if it was originally intended that way.
So I think actually the answer to the first part of this question is actually the answer to the previous question. I think it's really important for us to be able to understand what our individual child needs, right? So we have a tendency to go online, right? Google, ChatGPT today, right? Like ask, like, what should I do if my child is this? But those answers are not about your child, right? Those answers are based on some sort of average of the general population or sort of studies that have been done on autistic children, but those are not tailored to your child. And so every parent, I think, needs to understand who their child is and what their child needs from them. And I think that's what parents need to do. And then I think that sort of segues into the second part of that question, which is really hard. And I'm speaking humbly also as a member of national committees here. I don't put a tremendous amount of faith in our systems. And I think that the people on this Zoom call probably understand that, like, we need to take things upon ourselves. And whether that's ourselves as researchers or as clinicians or as parents or stakeholders from any perspective, it is our job to advocate for change. It is our job to go to the people who have the power to create systems change and make clear to them that, that we can do better. And that we can create systems that are flexible, that can be tailored to individual children's different needs. But we also, on some level, have to sort of be that change ourselves, right? And so I think there needs to be a top-down approach. And in academia, I think that this field of knowledge translation and conveying what we find in the lab and in academia to policymakers so that they know that there is an evidence base for decisions that they should be making is really essential. And that is our, I think, moral and professional responsibility. It's actually, knowledge translation is a field I learned from Stelios about many years ago. So I think that is our responsibility. But also, I think, we also need to work bottom up. And so whether that's with the specific children and families that we have access to, specific school systems, and then eventually districts and, and moving on up.
Wonderful. What are some ways to help parents understand and implement boundaries, limits, and expectations to support their child?
Can you say that one more time?
Yep. The best ways to help parents understand and implement boundaries, limits, and expectations in a way that supports their child.
I think I'm going to sound like a broken record. And not all children need the same thing. And not all parents need the same thing. Not all families need the same thing. I always say when I talk about autism, we have these statements that begin with autistic children, ... But there's no such thing as autistic children. That's not a homogeneous group. And so almost any sentence that begins with that phrase is automatically going to be incorrect, at least partially. So I think that in the end, the answer depends, which I know is a frustrating answer. And I would say that in the clinic, that's not the answer that I would give. I would work with families to understand the child and to understand the parents and the family system and the home environment and figure out what makes sense for them. But I am very wary of giving these sort of blanket recommendations without having details about that subjective child and family. Even outside the context of autism, children need boundaries, right? And we need clarity, and we need to know what is expected of us, and what happens when we behave in a certain way and what happens when we behave in another way. And that's true about humans, very broadly speaking. So those things are important, but the way in which they should be implemented and the types of boundaries and structure that should be implemented, I think it really just needs to be subjectively determined based on the needs and the profiles of specific children and families.
Is some of the scaffolding an issue with accommodation due to the social mismatch? Meaning, if social cues or processing speed or focus, for example, the child interested in a puzzle piece as a piece rather than a task to complete the larger picture, does the typical speed of neurological adults or peers overtake the child's and they can't keep up, so they default to you do because they can't integrate and make it a typical we do?
Yeah, so I followed most of that.
Yeah, I think so. Yeah. So insightful. It's almost unfair to have such like a deep, detailed question just submitted, but we'll do our best.
I think If I understand correctly, the question is if it stems from sort of a mismatch, like if parents and children are sort of on different wavelengths, functioning at different paces, processing information, at different speeds, and then like parents will have a hard time waiting, right? And then they'll sort of like they'll overfunction, right, in order to compensate or in reaction to that. I think it's a really interesting question. I don't know the answer. We have looked at the association between different parental traits and increased or decreased family accommodation. We actually thought one of our early hypotheses was that maybe parents with increased autistic traits themselves. We have a number of autistic parents who've come to the lab as well. We thought that there might actually be a better match between those parents and children, because there is literature on sort of autistic to autistic communication being more synchronous and better flowing than autistic to non-autistic communication. We didn't find that in our work. That wasn't our finding. And so I'm not sure what it stems from, actually. Like I feel comfortable saying I'm not sure what it stems from. I think what is clear is that the parent engaging the accommodation, wherever that accommodation sort of stems from, it's important for them to understand the significance of that accommodation. And again, there are contexts in which it makes a lot of sense to accommodate, but there are also contexts where a parent may step back and say, wait, I'm doing this, I'm preventing something from happening that maybe should be happening, that may be for the good of my child and for me and for our relationship and our family.
Okay. Thank you. Thank you. When considering the potential patterns of accommodation parents may provide, so good or maybe not as helpful, do you think this research highlights the value of early identification of autism to support or to enable the support early for child and family functioning?
Yeah, that's a great question. We assumed that when we followed families up a year later, the accommodation patterns would be totally different, right? Because at the baseline, it was the first time that children were being diagnosed as autistic. And so we assumed that parents would learn that their children were autistic and would sort of reorganize their entire lives and start acting differently. And that wasn't the case. Actually, we found that accommodation is not always, but much more stable than we thought it was. And so now I don't remember the exact question.
Do you want me to repeat?
Yeah,
do you think
good, that'd be
research,
awesome.
do you think the research highlights the value of the early identification of autism to enable the support early for the child and family functioning?
So I think we have enough research that supports that. We know that earlier diagnosis is better on every level. Access to intervention and system support, family mental health, to understand who my family is and who my child is. I'm not sure that I think we thought initially that maybe if we could identify, right, these patterns earlier on, then we would incorporate them in sort of a support package or an intervention program early on. But it's actually not what we're doing. We are doing an intervention study in family accommodation, but it's only one that starts at least a year after the child is diagnosed. We believe that actually there are more fundamental traits and needs for these kids that need attention earlier on before you can move on to something like accommodation. So I think my short answer, which is not so short, is that I don't think that this work necessarily points to the need for early identification, but there is ample work that does that.
Wonderful. I am going to squeeze in one last question to wrap up with, because it was pre-submitted to our registration. It is just delightful. So I think it's a great note to end on. This person submitted the question and or comment that says their child is 4 years old, nonverbal, but happy as a bug in a rug. We love him and always tell him that. I wonder if that has an impact.
The answer is, of course. I think that is the answer. And it actually goes back, this wasn't intentional, but it goes back to my answer to the first question, right? Like, that's what matters. The kids need parents who see them, need parents who love them. And there's no question that they may not have the verbal or communicative abilities to tell you that it matters to them, but it matters. And it's everything.
On that note, why don't we end there? That is a lovely kind of, emotional kind of end point to this. Thank you everybody for attending. As always, thank you, Judah, for a wonderful presentation. Thanks for joining us.